Congresswoman Katherine Clark of Massachusetts, the Democratic whip in the House, and she joins me now. I have to say, and maybe this will resonate with you, you've been a member of Congress for a while, I've been covering politics for a while. Nothing makes me feel like we've returned to some recognizable normalcy than a president struggling with poor approval ratings, like hitting the road to sell his agenda. It's like, oh yeah, I recognize that.
Remember that.
Do you think the speech is going to work?
I do not. I do not. And I think the American people understand what they're feeling, and that every time he says that cost of living, affordability, however he wants to put it, is a hoax, it is not what their lived experience is telling them. And I think we are seeing that not only in election results and polls, but in the president's own, he is not in control anymore. And he betrayed what he said he would do. I'm going to lower costs on day one. That was his promise. And ever since then, whether it's through tariffs, taking away health care in order to have tax cuts for very, very wealthy Americans, he has pushed prices higher and more out of reach. And the American people are telling us loudly and clearly, we can't afford the quality of life we want to be able to provide, to have a little breathing room. And that's what Democrats are fighting for in the House. And this is what the challenge is going to be for them as they go into the midterms in 26.
Yeah, you mentioned that some of his own voters and people within his coalition, the polling has that 46% say the cost of living in the U.S. is the worst they can remember it ever being. And that's a view held by 37% of 2024 Trump voters, which is a very, very high number. Now, obviously, it's the case that the president doesn't have some knob they turn to control the price level in the country, something that Joe Biden learned, the hard way, right? It's hard if inflation's taking off. In this case, the tariffs, he affirmatively has chosen, that's raised prices. And now you've got this health care question, right?
Right.
There are, I understand, every member of the Democratic caucus is now on a discharge petition.
That's correct.
To continue the subsidies that would stop these health insurance premiums from spiking. I think before the Epstein petition, I would have said, these things never work. This is like a mythical. But we just saw the Epstein petition. Like, is there a universe in which you get 4 Republicans to sign the discharge petition to stop people's health insurance premiums from spiking?
I would certainly think so. And, what we're seeing here is a corrupt bargain to take away money from Medicaid, from Medicare, to take away the tax credits from the Affordable Care Act that people depend on, to curtail and in some cases end medical research in this country, all to rig our tax code more in favor of the very wealthy. And we have seen nothing. There has been no work done to address this by the House. All they have done is take away people's health care. They've cut food programs. They've cut medical research. And they are not offering any solutions. And then you compound that with what we've seen from the impact on tariffs, certainly on large business, but our small business communities, as I travel my district in the country, they are so anxious about how they're going to move forward.
Even the complexity is insane.
The complexity is insane.
Over and above the cost, right?
That's right.
I want to ask you about something going on the other side of the aisle. I find this very interesting. I thought you would have an interesting perspective. There's tumult and a little bit of rebellion happening in the Republican caucus. It has a lot of different sources and a lot of vectors. But one of them seems to be gender. Women in that caucus increasingly saying publicly, Mike Johnson does not respect them. He doesn't put them in leadership positions. They feel steamrolled, condescended to by him. What do you make of that?
Does this really surprise anybody that Mike Johnson isn't a big champion of women, whether in his own party, and certainly not of American women? And we've seen that from positions, things he's stated, and from the policies and the impact they're having. If we look at women in this country, not only reproductive freedom, but in 1/3 of all counties in this country, there is no doctor to have a baby with.
Is that statistic true? 1/3 of all counties?
1/3 of all counties. And in states like Georgia, states that have abortion bans, it is even higher. It is about 50% of their counties. And that is no OBGYN. And as I travel to rural hospitals, it is insane. And so what are we saying to women in America? Just this, past few weeks, not only do we have this crisis in healthcare for women and maternal care that wasn't doing so well before the Trump administration and the House Republicans rolled into town with their cuts. But we're also saying that women-dominated professions like nurses and teachers and social workers and physical therapists, they're no longer considered professionals, and we're going to cap what you can loan to pursue that degree. I mean, we get it as women. We hear Mike Johnson quite clearly.
This was a regulation recently announced by the Department of Education that reclassified those professions so that they can't get full
$100,000 cap.
$100,000 cap on the what aid they can get on student loans. Congresswoman Katherine Clark from Massachusetts, thank you very much.
Thank you.